Welcome to today's lecture on Pseudomonas infections. In this comprehensive session, we will delve into the intricacies of this pathogen and explore various aspects of its pathogenicity, prevention, diagnosis, and management. Pseudomonas infections pose a significant threat to public health, particularly in healthcare settings, and understanding the fundamental concepts is crucial for medical professionals. Pseudomonas infections, caused by various species of the Pseudomonas genus, are a significant concern in both community-acquired and healthcare-associated settings. These infections can affect multiple organ systems, leading to diverse clinical manifestations. Understanding the microbiological characteristics, such as the gram-negative nature and the common species encountered clinically, serves as a foundation for effective diagnosis and treatment strategies. Pseudomonas aeruginosa, the most notorious species within the Pseudomonas genus, has an impressive arsenal of virulence factors that contribute to its pathogenicity. The secretion systems, including the type 3 secretion system and the quorum sensing mechanisms, enable this bacterium to establish infections and evade host immune responses. Additionally, biofilm formation, antibiotic resistance, and efflux pump systems further complicate the management of P. aeruginosa infections. The emergence and spread of antibiotic resistance in Pseudomonas species represent a worrisome global health issue. Understanding the mechanisms of resistance, such as efflux pumps, beta-lactamases, and target site modifications, is crucial for selecting appropriate antimicrobial agents and implementing effective infection control measures. Furthermore, exploring novel strategies, like combination therapies and the use of bacteriophages, offers hope in combating multi-drug-resistant Pseudomonas infections. Nosocomial Pseudomonas infections, acquired during hospitalization, pose a significant challenge due to their association with increased morbidity and mortality. Implementing stringent infection control measures, including hand hygiene, environmental cleaning, and adequate disinfection protocols, can help minimize the risk of transmission. Surveillance programs, antimicrobial stewardship, and the use of single patient rooms with appropriate ventilation play pivotal roles in preventing nosocomial outbreaks. Cystic fibrosis, CF, patients are particularly susceptible to chronic Pseudomonas infections, which significantly impact their respiratory function and overall prognosis. The complex interplay between Pseudomonas biofilms, impaired mucociliary clearance, and host immune response necessitates aggressive treatment approaches, including inhaled antibiotics, airway clearance techniques, and early detection through regular surveillance. Detecting and identifying Pseudomonas bloodstream infections can be challenging, primarily due to the low concentration of bacteria in the bloodstream. Various diagnostic methods, such as blood cultures, polymerase chain reaction, PCR, and biomarkers like procalcitonin, aid in accurate and timely diagnosis. It is crucial to differentiate true infections from contamination and implement appropriate antimicrobial therapy promptly. Immunocompromised individuals, including solid organ transplant recipients and those with hematological malignancies, are highly susceptible to Pseudomonas infections. The compromised host defenses, along with the inherent virulence of Pseudomonas species, contribute to a complex clinical scenario. Tailoring antimicrobial therapy based on susceptibility patterns and providing supportive care are essential in managing these challenging cases. Combination antibiotic therapy has gained attention in the treatment of Pseudomonas infections to enhance the chances of therapeutic success. By targeting different mechanisms of action and minimizing the emergence of resistance, combination regimens have shown improved outcomes in specific clinical scenarios. However, careful consideration of individual patient factors, bacterial susceptibility patterns, and potential adverse effects is crucial when deciding on combination therapy. Pseudomonas pneumonia, a severe and life-threatening infection, requires a comprehensive approach involving prompt diagnosis, appropriate antimicrobial therapy, and supportive care. Understanding the pathogenesis, including the bacterial factors, host immune responses, and the role of biofilms, helps guide therapeutic interventions. Optimal pharmacological dosing, ventilatory support, and addressing complications, such as sepsis, are vital in achieving favorable patient outcomes. Pseudomonas skin and soft tissue infections, including folliculitis, cellulitis, and ecthyma gangrenosum, present unique challenges in diagnosis and management. Empirical antibiotic therapy, based on clinical presentation and local epidemiology, may be necessary initially. However, obtaining appropriate specimens for culture and susceptibility testing remains crucial for targeted therapy. Enhancing wound care measures, considering surgical interventions when required, and addressing underlying immunosuppression are vital components of management. Burn patients are highly susceptible to Pseudomonas infections due to compromised skin integrity and altered immune responses. Early recognition of infections, prompt wound debridement, and tailored antimicrobial therapy are essential in preventing sepsis and ensuring successful burn wound management. Vigilant surveillance and adherence to infection prevention protocols significantly reduce the incidence of Pseudomonas infections in this vulnerable population. Advancements in our understanding of Pseudomonas virulence regulators have opened up possibilities for targeted therapeutic interventions. Unraveling the intricate regulatory networks, such as quorum sensing systems and regulatory proteins, provide opportunities for developing antivirulence agents. Disrupting crucial signaling pathways and inhibiting key virulence factors could potentially revolutionize the management of Pseudomonas infections. In conclusion, understanding Pseudomonas infections is crucial for effectively managing them. By improving our knowledge on the basics, pathogenicity, antibiotic resistance, prevention, diagnosis, and management, we can combat these infections. With a multidisciplinary approach and infection control practices, we can mitigate their impact on public health.